Hello everyone, thank you for gathering here today for this presentation. My name is Jordan Landrum and I am a registered nurse traveler. I have been a nurse since 2011 with the vast majority of my experience residing in the med-surg and public health realms. Today we're going to talk about pediatric leukemia. Pediatric leukemia is a frightening disease process for clinicians and providers and for the patient to face. A lot of this fear comes from the age group that we're caring for at the time. The following slides will break down pediatric leukemia into manageable pieces so you as clinicians and providers can understand the idiosyncrasies of the disease process and how it affects the body. We will first discuss the typical population and the goals for care in that population, followed by a discussion of specific health promotion and risk reduction goals. I will then break down the pathophysiology of the disease process and how it affects the body. Typical symptomology and critical assessment findings will also be discussed, followed by what lab tests will typically be ordered and the expected values. I will then present an overview of holistic therapeutics that can be appropriately utilized in this complex population. And finally, we'll discuss the outcomes to be expected amongst the interdisciplinary team. The objectives of this program: by the end of this presentation, providers and clinicians will be able to explain what leukemia is and the two most common types in pediatrics. They will have a general understanding of the common symptoms and how to combat against those, and they will understand the special considerations when caring for those diagnosed with leukemia. So what does pediatric mean? A pediatric patient is any child immediately after birth to the age of 21 years old. Many times, even after the age of 21, some clients are still considered pediatric patients due to special considerations. For instance, if a patient is diagnosed with leukemia at the age of 20 and are still in treatment at the age of 22, they would still be considered a pediatric patient. Leukemia is the most common pediatric cancer with a common incident rate of 8.8 out of every 100,000 children. Leukemia also accounts for the highest incidence of cancer-related death among this same age group. Children facing disease are a special case. It is difficult to explain to them exactly what is happening because their level of understanding is low compared to when speaking to adults. Just because this level of understanding is low does not mean we can ignore the importance of education for these clients and their families. Developmental stages change so quickly from childhood to adolescence and then adulthood. A general understanding of the developmental stage of the patient is important in providing appropriate care. Always remember, patient-centered care doesn't always mean just the patient. The family will play a vital role in the care of the pediatric patient. Health promotion and risk reduction. Leukemia has a tendency to reduce the efficacy of white blood cells in fighting infection. Couple this with the fact that most treatment for leukemia can cause a lowered amount of white blood cells, then these patients become at a much higher risk for infection. The use of standard precautions is vitally important when caring for these clients. Appropriate hand washing and education on standard precautions for family members is important in protecting these patients from infection. Sometimes it is even appropriate to place the patient in a form of reverse isolation or have them wear medical masks when outside in public. This can be embarrassing but vitally important for the safety of the client. When these patients are in the hospital setting, an appropriate healing environment could help alleviate the anxiety and depression they may be feeling. Let them have their favorite stuffed animal or blanket. Make sure the hospital room, IV infusion room, wherever these patients are, make sure it's as close to being at home as possible. The use of comfort or palliative care can be a difficult subject to bring up, but it is important to separate the idea of palliative care as being solely end-of-life care. These patients suffer from extreme fatigue, nausea, and many other symptoms. Their comfort should be one of the most important aspects of promoting the health and the future health of these clients. Pathophysiology of the primary diagnosis. Leukemia comes in two forms. It is either myelogenous or originating from the bone marrow, or lymphocytic, which means originating from the white blood cells. These two forms of leukemia can either be chronic or acute in nature. The vast majority of leukemias that are associated with childhood are acute in nature, so that is what we are going to discuss. Acute myelogenous leukemia originates in the bone marrow, and bone marrow blasts or cancer cells will eventually overtake the bone marrow, slowing down or even stopping the production of new white and red blood cells. These cancer cells can never mature into appropriate red and white blood cells. Acute lymphocytic leukemia originates in the actual white blood cells. These cancerous cells will form blasts or tumors that will settle in the various areas of the lymph system. These cells will also never mature or differentiate into the specialized white blood cells that make up the immune system, thus causing leukopenia. In both forms of leukemia, these mutated blasts begin to stack up and replace bone marrow and/or lymphocytes to the point that the body is not producing red and white blood cells in an efficient manner. Pathophysiology of the primary symptoms. Myelogenous and lymphocytic leukemias tend to present the same symptomology, and the disease itself is difficult to diagnose due to just symptoms alone, because they have a tendency to masquerade as other disease processes. Fever of unknown etiology is one of the most common symptoms associated with leukemia. This fever can be extremely elevated and is thought to be caused by the cytokine production of the cancer cells in the body. This fever also is specialized in the fact that it remains unaffected by the common methods to combat it, such as Tylenol. Leukemia also affects the production of white blood cells. These immature cancerous white blood cells do not protect the body in the same way that healthy white blood cells do. Couple this with the fact that most chemotherapeutic agents also compromise the immune system, and you can end up with difficult to treat and numerous infections. The cytokines mentioned above also have a tendency to cause a loss of appetite. Again, coupled with treatment and how hard it is on the body with nausea and vomiting, and the patient can suffer dehydration and extreme weight loss. Poor clotting factors can lead to anemia, and lymphoblasts can actually act as clots, causing pulmonary embolism and even death. All of these symptoms work together to create a profound fatigue in the client. Then treatment also takes its toll on the human body in and of itself and results in even more fatigue on top of more fatigue. Appropriate rest cycles and sleep patterns are important for positive outcomes in the leukemia patient. Critical assessment findings. When assessing the leukemia patient, many aspects are considered to be critical and must be addressed. High fever of unknown etiology is important to note due to the many negative effects it can have on the body, such as additional fatigue, and if the fever is unchecked, even death. Bleeding issues are common in leukemia patients, so any bruising should be considered a critical finding. Overall malaise is an expected finding, but an extreme malaise should be considered critical. Ocular manifestations of leukemia are not always common, but any changes in vision should be noted as critical due to the possibility of eye involvement. Capillary refill, skin turgor, appetite, and urine output, and the changes you may see in these areas are all critical findings as well. They should be closely monitored in order to step in front of these symptoms and maintain patient safety. These symptoms can also tell you whether or not the client is edging closer to dehydration. It is important to continually assess for signs of anxiety and depression in order to properly treat the patient quickly. Anxiety and depression are common in these clients and can manifest over a short period of time or a long period of time. Typical lab values and diagnostic data. Trips to the laboratory will be common for the leukemia patient. A baseline must first be established, and then this baseline will be referred back to when comparing new laboratory values. A CBC or complete blood count will be used to determine blood counts, how many white blood cells and red blood cells are in the body. Any lowering of blood counts is important to note and is an expected finding as treatment progresses. Clients with leukemia also have a tendency to lose their appetite, so a comprehensive metabolic panel, or CMP, will be drawn regularly in order to make sure that electrolyte levels stay within normal ranges. These levels will also give the clinician and dietitian ideas on how to change the client's diet for better outcomes. Cytology will be used to determine the type of leukemia that the patient has, and MRIs, CTs, and PET scans will be used to determine the extent of the cancer in the body. Chromosomal testing is also sometimes used in order to further focus in on the type of cancer attacking the body. These lab values will give the clinician the ability to know how well treatment is progressing and if anything needs to be changed. Also, continued study of lab values lets the provider know what trends the client is following and the ability to react accordingly. Holistic therapeutics in leukemia. There are many pharmaceutical interventions that will be used when a client has leukemia, but often forgotten are the alternative and holistic therapies that can have positive outcomes for pediatric patients and their families. Holistic therapies are making waves in medical care in today's day and age. The use of various forms of alternative medicine to provide appropriate outcomes for clients in need has grown in recent years, and studies are beginning to show extremely positive outcomes for clients linked with these therapies. There are many alternative therapies out there, but today I will focus on four of them: therapeutic massage, meditation, nutritional counseling, and physical therapy. Therapeutic massage can have increased can help increase comfort and assist in pain management with those suffering from leukemia. The massage therapist can tailor-make each massage in order to work on a problem areas for that client. And in my interview with the massage therapist Heath Frazier, he states, "I've seen many cancer patients come out of a massage with increased energy. This increased energy and combat against fatigue is amazing for leukemia patients." Meditation can also provide periods of rest and quiet time, which combats fatigue, and also with guided imagery being a part of meditation, can actually lead to positive outcomes in pain management. Nutritional counseling may not seem like an alternative therapy, but keep in mind with many cancer patients, we are not thinking about the entire team of clinicians that can help us combat this complex symptomology. When dietitians and oncology teams work together, they can tailor-make a diet plan that has been created and will maximize the amount of good caloric intake for the meals that the client is actually able to eat. And finally, again, physical therapy at first glance doesn't make sense, but the physical therapist can help provide fatigue management through the use of light exercise daily. And they can actually tailor-make exercise programs for the client that are more appropriate for them. Collaborative outcomes. The power of teamwork. Collaborative outcomes that can be expected in leukemia care are lowered instances of infection. When the physician works with the laboratory technicians and can get lab values quickly, the client has a lowered instance of infections because we can see that the lab values or the white blood cell count is going low and that a client is becoming neutropenic. Another expected outcome is lowered hospitalizations. When somebody's care is closely monitored by a team of people, they are less likely to have to go to the hospital because when they start to decline, somebody notices it and actually alerts the appropriate team members in order for the patient to be taken care of appropriately. Better patient satisfaction and better satisfaction as a whole. When a client feels like the team is on their side, they will be more satisfied with their care. And by the team working together and including the client and their family in conversations, that patient will feel like they're at the center of their care, and that is most important. The interdisciplinary team working together is a beautiful thing, and it is important to know the strengths of each team member and utilize them appropriately. When a client or their family are facing such a horrifying disease process, a steady team that they can count on will go far in creating a positive environment for them to heal in. The oncology physician, oncology nurse, dietitian, pharmacist, physical therapist, massage therapist, family members, and patients must work together in order to reach these positive outcomes. In conclusion, patients suffering from leukemia are complex. The disease process itself is complex and difficult to understand, and sometimes even more difficult to explain to the patient and family members. Couple these facts with the idea that these are children facing something they should never have to face. It is important to never forget that your patient is a child. They look to adults for support and help. With teamwork and education, these clients can have positive outcomes and will remain in your heart for all time. This slide presents a list of references used in the completion of this project. Thank you for your time today, and I appreciate you sitting and listening to my in-service. Thank you.